There are 59,474 confirmed cases of COVID-19 in Canada and 17,533 cases in Ontario. Chatham-Kent has 88 cases and Sarnia-Lambton has reported 189 cases. Michigan now has 43,754 cases, with 9,386 cases being in Detroit. Today, we are reporting 641 cases of COVID-19 in our community, an increase of 18 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 202 cases are resolved. 17 people are in hospital. 16% of our total cases are between the ages of 20 and 29 years. 16% are between the ages of 50 and 59, and 22% of our cases are 80 years and older. 40% are male, 59% are female, and 1% is unknown. Our community has lost a total of 54 people to COVID. 40 deaths have occurred among residents in long-term care and retirement homes. Our health unit is now working with 8 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on clinical assessment. The symptoms include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsor-essex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Health Care in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As you've seen, the number of cases in the 20 to 29 age group is increasing, which now constitutes 16% of our total case count. Majority of those cases are in healthcare worker, but I would like to take this opportunity to remind everyone, even the younger ones in that age group, to take appropriate precaution to protect themselves from COVID-19, because when you're protecting yourself from COVID-19, you're not protecting yourself alone, you're also protecting your family, your loved ones, and the people who are around you. So please take your time to protect yourself from COVID-19 by taking all the precautions, including physical distancing, hand washing, and maintaining good respiratory etiquette. I regret to report the loss of 3 more community members, 3 more deaths in the community members related to COVID-19. A female in her 90s, a female in her 80s, and a male in his 60s. They all passed away yesterday. All these 3 individuals were residents of long-term care home. I share my sympathies with all the families who are grieving the loss of a loved one. Our thoughts, our prayers are with the family. The WECHU continues to monitor all 44 long-term care homes and retirement home in Windsor and Essex. There's a lot of information to take in related to COVID-19, and it changes rapidly. The Windsor-Essex County Health Unit is constantly updating the information on our website to ensure that the residents of Windsor and Essex have access to most up-to-date, credible information for COVID-19 in our community. The information that we are presenting, it's easy to understand and sometimes also includes questions raised by our community members. The local update page on our website has been improved with visuals for easy understanding. We've also added a new section under Healthy at Home. This section covers important health promotion topics such as mental health, sleep, physical activity, food and nutrition, and pregnancy and breastfeeding. The frequently asked questions section is also updated regularly. Please visit our website to access most up-to-date and current information on COVID-19 in our community. Thank you.
We'll now take questions from the media. We'll start with the Windsor Star.
I'm okay right now, thank you.
CBC.
Your website seems to have crashed on me. What is the new long-term care home that's in outbreak?
I think we added one more facility under the long-term care outbreak, which is the village of St. Clair. Yeah, and it makes it a total of 8 long-term care homes that are currently in outbreak.
Would you have the number of how many staff or residents have the virus?
The new home, it's only one staff.
Of the recent positive cases, how many of those are community versus how many are in long-term care?
Right now, we're still getting more details about these cases. Majority of them, it seems like it is, again, from the long-term care homes. We have ramped up testing in the long-term care homes and doing mass testing at many of the facilities. Most of the cases that we are getting are from those facilities. I can't give you an exact answer on how many. Hopefully, by tomorrow, we'll have a better answer on the exact breakdown of these cases.
And I think it was Friday, it almost doubled in the amount of pending results. Is that because you did another sweep of the long-term care and retirement homes?
That is correct. Even over the Saturday and Sunday and today, we are doing a number of long-term care homes and retirement home mass testing. And those testing numbers ranges at anywhere between 300 and 400 every day. And we are getting the results back, but also we are doing much more testing as well.
Okay, thank you.
Any questions from Blackburn?
Yeah, just to follow up on your latest comment, I think people are concerned. They keep seeing the same number of pending tests around that 1,300 mark for the last, I guess, 3 or 4 days, I would see. So just, I mean, what can you say to reassure people that, you know, even though you are seeing around the same number, it's just that you're doing that many more tests, you're still getting results back daily, you're still, you're not feeling, I guess, concerned with the number of tests you have pending?
Well, absolutely, I am concerned that we want to get the test results as quickly as possible. There are a number of conversations happening at multiple levels, and I have raised these concerns with various levels of the government as well, that we need those test results back quickly. And as much as we want to get all those long-term care homes and all the residents and staff tested at those facilities, but I am also interested in getting those results back quickly. So there are a number of conversations that are happening right now, and our hope is that all this will improve as we move forward, because everyone at the different levels of the government know that it's not only just us. Almost every health unit and every long-term care home and retirement home are getting tested, and there are significant number of improvement that happened over the last few days, and we're expecting that it will continue to happen in the next coming days to increase the capacity to make sure that we are getting the results in a short period of time. The number of positive that we received over the weekend, it include many of the tests that were conducted 2 to 3 days ago. And again, it's just the prioritization piece. We are working with the lab to get those results quickly back to us.
And you said, you know, you're doing, when you're doing those mass sweeps, you're doing 300 to 400 tests a day. About how many do you get back daily?
So if you do the maths, I think we are getting back over the weekend, I would say roughly 300, 400 test results came back because yesterday the number was around the same. So even though with additional testing, the number of test results are still pending. And our hope is it will continue to go down significantly in the next coming days.
Any questions from CTV?
Yeah, I'm just curious. Thoughts on businesses opening today, or the slow opening of the economy? You got the buses. I saw a bus on the road today. That was kind of cool. Just your thoughts, and will you guys be out monitoring just to ensure that people are following the regulations and whatnot?
So there are a number of ways that we ensure that the Emergency Management and Civil Protection Act are followed. Some of them fall under the public health domain. A lot of the other fall into the police and the bylaw domain. So we will be working with our local law enforcement agencies and bylaw officers to ensure that all these businesses and individuals are complying with the Emergency Management and Civil Protection Act, and will continue to do that. So that's one side of the things. The other side of the thing is we are also interested in ensuring that even with the slow opening of the economy, how will it impact our community from a spread perspective. So we want to make sure that all these opening or all these measures that are currently being taken, it doesn't have a negative impact on all the good work that we have done over a number of weeks and months to get us to the point of flattening the curve, and we'd like to see those measures continued to ensure the safety and well-being of our community. So we'll be keeping a close eye on all of those things to make sure that our community continues to stay safe and protected.
Are you holding your breath?
Absolutely, and I think this is a very crucial time, and all the good work that everyone has done, including all our community members. I think we have put a lot of effort. It's not easy to follow all those guidelines, but we have made it through, and I like to see us cross the finish line with more success rather than going back to where we started from.
Any questions from AM 800?
Yeah, I'm just wondering, Dr. Ahmed, if you've heard from the Ministry of Health or the province about the state of emergency. It's supposed to expire next week. So just wondering if you've been given any updates in terms of, what the status of that will be.
So obviously, those conversations happen at the provincial level. We haven't heard anything for sure. All I can say is our Chief Medical Officer of Health and others are involved in those conversations, and everyone is looking at those numbers and how we are comparing what's the new case count looks like and how it's increasing. So I think there are a number of conversations that are happening right now, and I don't know what the outcome would look like, but I'm really hoping that everything that happens, it results in it doesn't result us getting more cases in the community, and we want to make sure that the good work that is already happening, it continues to happen with respect to physical distancing and all the other measures that public health has put forward.
Okay. Sorry, your website still seems to be down, but when I checked earlier this morning, I noticed, I think it said that there were 8 cases of COVID in people between the ages of 0 and 19. We're not hearing of a lot of young people getting this virus. So is this concerning to you, or do you have any information on those cases in particular in terms of, maybe pre-existing conditions that led to contracting COVID?
So I guess the good thing that happened in March when the school was shut down to prevent the spread of COVID-19 in that population, and as majority of us, even if we have to go out for essential work, for groceries and other stuff, we're not taking our children with us most of the time. And even when we are being very protective of all of them. So I guess in terms of contracting the disease in the first place, that has already gone pretty low. Most of these cases, I would expect that is happening in the younger population is probably a contact transmission from their community, from their family. So as long as we are taking good care of our children, they are safe. We know that parks and playgrounds are also closed for access for these children. So majority of even, like, for example, my children, they are just going outside biking and running and doing things independently without hanging out with their friends. And that is significant from a risk of transmission perspective. Yeah.
Okay.
The website is now back up and running. Any questions from Windsor-Essex?
Dr. Ahmed, you said the majority of the 18 new cases today were in long-term care. Are you concerned that some of those cases are in the community because of things reopening and people starting to get antsy being at home?
Well, I think it would be too early to say because many of the cases that we see, it takes an incubation period of 14 days, and anything that what we are seeing today, it's essentially could be a result of what happened a week ago or at least 2 weeks ago. So it is something that we are keeping a close eye on. With the restart of the economy, we'll have to be again very careful in monitoring all this changes that happens from today onwards. And as we also know that the weather is getting nice, more and more people are spending time outdoors, and it is important that we all continue to follow the public health guidance, including physical distancing. And it is important. Doesn't matter what happens in the next few weeks or in a month time. The disease has not gone away. It is still exists in our community, and it is important for us to take the appropriate precautions even when we are outdoor, even when we are going to the trails, even when we are going to our essential workplaces, grocery stores, pharmacies, anywhere we are going. We would like to make sure that people are still following all those guidelines as best as they can, and we like to see that continued downward trajectory of the number of cases in our community.
Any further questions from the Windsor Star?
Yes, I'm just wondering, do you find that people are recovering in about 14 days? We have 202 resolved cases. So I'm just wondering, how long are people having to endure these symptoms for?
Well, majority of them are taking 14 days to recover, so that's why we can say with confidence that the 14 days is the typical recovery time period, and we are getting all those information back as quickly from all the residents who are currently self-isolating. And the moment we get more details, we update them and put them in the resolve criteria.
Thank you.
Any further questions from CBC?
Yes. Do you have any information on the person who died over the weekend?
I mentioned that yesterday we lost 3 lives, a female in her 90s, a female in her 80s, and a male in his 60s, all residents of long-term care home or retirement home.
I believe it went from 50 to 51, though, on Saturday.
I don't have that information right in front of me, but I can say that most of these individuals are from long-term care home and retirement home.